Hello and welcome everyone to Pro Live. Today is a very special show because I have a co-host today. I am joined by internationally renowned, highly trained, double board certified plastic surgeon, Dr. Luis Macias. Hi, Dr. Luis.
Hello, hi.
How are you?
I'm great. Thank you for having me.
I'm so excited that you're here with us. It's truly an honor, and it's your Pro Live debut, is that correct?
That's correct. First time on Pro Live.
Okay.
Hopefully not the last.
Hopefully not the last. Yes, I love it. So we are, if you notice, in a treatment room, and this is actually your practice, Aesthetic MDR.
Correct.
Right? Can you tell us a little bit about Aesthetic MDR and a little bit about yourself? Share with the audience.
Sure. Aesthetic MDR is our practice here in Marina Del Rey, California. We're a plastic surgery practice, but we have estheticians, PAs, and plastic surgeons. So we treat from the skin all the way down to the deep plane. So we do surgery, and our specialization is in natural results. So what we want people to know is that if you come to our practice, we're going to try to make you look natural and not so that anyone knows that you have us or a plastic surgeon, that you go to see anyone. And that way, when you tell them your secret, they want to come see us because you don't look like you've had things done.
I love that. That's fantastic. And you are, among all of your accomplishments and accolades, I just also want to say you did serve in the Marines. Is that correct?
Yeah, that's correct. I was a sergeant in the Marine Corps, so I was enlisted. So after high school, I went to the Marine Corps. I was an avionics technician. I worked on board the FA-18 Hornet. I worked on the electronics on board the Hornet aircraft. Used the GI Bill to go to college. I went to UCLA for undergrad, and that's how I paid for it.
Amazing. Well, on behalf of SkinCeuticals and myself, thank you for your service.
You're very welcome.
Very, very happy to be co-hosting with you today. So today's show, everybody, is all about integrated skincare. How to really achieve the most comprehensive and long-lasting results. And here at SkinCeuticals, we are the #1 medical skincare brand rooted in medical advocacy. That's why we partner with world-renowned plastic surgeons like Dr. Luis Macias here. That's why he's here with us today. And Aesthetic MDR is actually a SkinCeuticals flagship location. So you can actually come here and, like Dr. Macias was telling us, really kind of experience everything from shopping the entire SkinCeuticals product portfolio to seeing an esthetician to seeing PAs here and really taking a comprehensive approach to overall skin health to get you to your skin goals faster, whatever they may be, all while looking natural and looking like yourself, right?
That's our goal.
Yeah, that's the goal. So I love that goal. Today we have 2 exclusive sets available for you to take home today. The sets that we have are Restore AM set and Restore PM set. So both of these sets are strategically bundled together to really work with in-office treatments and procedures. And these are some of Dr. Macias' favorite products as well, which we're going to dive into education on both of these. But these are really going to help to give you that perfect regimen to use at home, either in prep for your in-office treatment, to maintain the results from your in-office treatment, or to really take care of that skin post-procedure as well, because all of that's important, again, to maintain optimal results and increase patient outcomes, right?
Absolutely. And that's why here, we have our estheticians, like for instance, for surgery, we're gonna do a facelift, for instance. That's my favorite procedure to perform.
Love it.
And do a ton of facelifts. But what we do is we have them meet with our esthetician at the beginning.
Okay.
They get a full treatment, full facial, and then they also go on with and make sure they have a comprehensive regimen for their skincare preoperatively. It's very important to treat the skin beforehand, and that way we get the skin ready for the surgery. Because then in the surgery, we're going to do our facelift and tighten up the skin and do the deep plane work. But then afterwards, we also need the very important follow-up and care of the skin with the products.
Yep, I love that. I absolutely love that. So we're going to take a deep dive into each of these products and how to use them together and really how to use them along with your in-office treatments and integrate that skincare, those powerful in-office treatments with your targeted at-home skincare solutions. With your purchase of either set today, whether you're taking home one or both, highly encourage adding both to cart. You are going to receive complimentary shipping. You're also going to take advantage of the site-wide gift with purchase that we have running right now at SkinCeuticals.com, which is a 4-piece mini regimen. You get to pick a deluxe size product of your choosing, and you're going to get a beautiful cosmetic bag to kind of house all of those products in as well. No code needed for that. And because we're talking about integrated skincare today, we're also going to be including a $100 gift card redeemable on a qualifying treatment at a SkinCeuticals Skin Lab or flagship location like this one. So if you're local to the Marina Del Rey area in Southern California, come on in. You can follow Dr. Luis Macias on Instagram and the practice on Instagram. Our moderators are going to drop that information in the chat as well as the phone number and the address and how to book. But what is the handle that everybody can kind of follow along and see what happens behind the scenes here?
So for the practice, it's at Aesthetic MDR,
Okay.
and then mine is at Dr. Luis Macias, Dr. Luis Macias.
Amazing. So if you're just tuning in, we are talking about integrative skincare and really guiding you on how to build a healthy skincare routine and regimen. So again, we are in Marina Del Rey in a real treatment room. I was actually here yesterday and I got to witness Dr. Luis Macias performing a radiofrequency and microneedling treatment. That was awesome. I want to get one.
Awesome. Well, you know where to get one.
I might not leave tonight and I might just stay and I might get in that chair and we might do it. I think I need to do it. So it looked amazing. I can't wait to see the patient's results. I think we have some footage of that. So we're going to pop that up on the screen so you can see Dr. Macias performing radiofrequency and microneedling. So can you talk the audience through this particular treatment? Who is it best for? What can a patient expect? What are the results? And anything you want them to know about pre and post care?
So microneedling with radiofrequency is a fantastic procedure. You know, we've always been trying to find ways of tightening the skin. Obviously, surgery with a facelift is one way, but some people aren't quite ready for a facelift, or it's just a little too early for a facelift. So microneedling with radiofrequencies have been fantastic for that group of patients.
Okay.
We can tighten up some skin on the face. It's also used on the body, but we love to use it on the face quite a bit. There's a hand piece for the body and for the face. The face one has 24 pins, and the 24 pins will go into the face, and it shoots at certain depths, and you can control it.
Okay.
The one that I like to use is one called Morpheus 8, and it's called 8 because it shoots down to 7 millimeters of depth, but gives treatment down to 8 millimeters of depth. So that's what the 8 means in the name of the product.
Clever.
It can go all the way down to 8 millimeters. On the face, we don't go that deep. On the body, it goes down to 8 millimeters. But on the face, we'll typically treat down to about 4 millimeters or 4 millimeters depth with the needle, with 5 millimeters of the heat actually treating down to about 5 millimeters.
Okay.
And that will help tighten the skin. The deeper the needles go, the more the fat can go away as well. So it also can tighten skin, but also reduce fat, which is very nice in the submental region. So a lot of people want a little bit of that submental fat gone, so we can treat it a little deeper with the radiofrequency there, and then more superficially we get closer to the dermis and we can help tighten up the skin. So in the treatment that you saw me do yesterday, I did a technique where I did double tapping, meaning I hit the same place twice at the same depth to try to increase that warmth, and then at different depths. So I did a pass at 4 millimeters and then another pass at 1 millimeter to try to tighten up that skin.
That's amazing. I mean, it looked like just such an amazing treatment, and it was fast. It is something you can just come in and get done and move on with your day. So do you recommend any products specifically to help prep for that procedure, or even products that you want to apply immediately after?
Yeah, absolutely. So after the treatment, you saw me apply the CE Ferulic. It's a fantastic product that we used on the skin.
Yep.
It helps restore and regenerate really quickly the skin. So patients love using this.
Exactly. So this is our daytime antioxidant vitamin C serum, and I love that you applied this right after, because it is safe for post-procedure application. This is going to help to neutralize free radicals. It has 15% pure L-ascorbic acid. It also has vitamin E and ferulic acid. So you want to apply this like Dr. Macias was talking about before and even after to really help maintain and amplify those results. Really great to help visibly brighten the skin. But because it's an antioxidant serum, a vitamin C antioxidant serum, it's going to help to neutralize those free radicals that we're bombarded with every day that really damage our skin and accelerate the aging process. So if you're concerned with preventing skin damage, addressing visible signs of aging, fine lines, wrinkles, loss of firmness, loss of elasticity, and overall just brightening the complexion, then CE Ferulic is something that is just a non-negotiable. You have to be using it every day. You want to use it once daily in the morning, apply to clean, dry skin, and then you can follow with the rest of your routine. So super, super easy to do. just iconic. At SkinCeuticals, we're known for our daytime vitamin C serums. We have different formulas, but CE Ferulic is probably our number one bestseller.
Yeah, it's a fan fave for sure.
It is a fan fave. Do you have a favorite SkinCeuticals product?
This is it.
It is? Okay, yeah. I love that. It is mine too.
Aside from the sunscreen, of course, because,
Yes, I love that. Prevent and protect.
Yes.
Yeah, we want both of those things for sure. So I love that. That is absolutely amazing. So next up, I have a question for you, actually. So we're coming out of summer. We're heading into the fall and the winter. Do you see in patients coming into the office any specific concerns that happen usually around this middle time?
Yeah, I mean, people come in looking for treating discoloration, very common from the sun, from the exposure over the summer. So discoloration is a big thing that we do have to treat.
Okay.
That'd be probably the most common.
Yeah, that makes sense, right? We're having fun in the sun, Southern California, all over really, right? The sun is out, it's hot. It's been a hot summer, so definitely wanting to come in and take care of that discoloration and undo some of that damage we may have done is something we want to pay attention to, and we can actually do that with our discoloration defense. That's a great segue into our next product included in the Restore AM set. So this is an anti-discoloration serum, 4 ingredients specifically that work together to target past, present, and future discoloration: tranexamic acid, kojic acid, niacinamide, and HEPAs. You want to use this twice daily in your routine. Great to help improve stubborn brown patches, uneven skin tone, and even past blemish marks. You can see results in as little as 2 weeks in some cases when you are applying it twice daily every day. But you really want to make sure that you're applying to the full face, because we never really know where that discoloration is hiding, right? Like,
exactly.
It happens early on and it kind of peaks up later.
And it is nice to use after doing things like a photofacial. We use another type of light face treatment, but it's fantastic to keep that at bay after we treat it.
Yep, I love that. Great post-care solution. Just amazing for everyday use as well. So when we say discoloration, I just want to remind everybody watching that think those stubborn brown patches, dark spots, uneven skin tone, and past blemish marks. And discoloration defense has been tested in even deeper skin tones, so you really are going to receive those benefits even if you are a deeper skin tone. So we love that inclusive testing with discoloration defense. Speaking of discoloration, I think we need to talk about sunscreen.
Well, that's how you can prevent it, right? That's the most important product. One of the most important products is this one for sure.
Yeah, definitely. And so I think this is one of your favorites too,
that
right?
Is.
Let's show everybody what this looks like, because it does have just a really beautiful finish to it. I love that it doesn't really feel or smell like sunscreen. I love that it has a beautiful kind of like radiant lit from within finish.
Got a cool little sheen to it.
It does. It does, and it does work. You can see on Dr. Macias' hand and on my hand, just blends in really seamlessly. I love the glow it gives, that healthy skin finish, and this is just an essential step, morning, rain or shine, really. And I'm sure it makes your job a lot easier when you see patients come in that have been putting on their sunscreen every day.
Yes, I wish more people would use their sunscreen regularly.
Hot tip. Everybody, use your sunscreen regularly, no matter what. And this is going to offer broad spectrum protection from both UVA and UVB rays. It also has ingredients in it like glycerin, which hydrate the skin and really give you that deep hydration. So you can use it as kind of like your hydration and sunscreen step. Not only that, it helps to brighten the complexion and even the skin tone with ingredients like tranexamic acid and niacinamide. So you can continue that correction into that protect step too.
And I think that was very important to see that don't forget your hands.
Yeah.
Because a lot of people just play on their face and they forget to put it on the dorsum or the back of their hands. This part can give you away sometimes. You spend some time doing it on your face, getting, your facelift, and then the hands give you away. So make sure you put some on your hands as well.
I'm going to hear your voice in my head tomorrow when I'm applying my sunscreen. That is true. Don't forget the neck and don't forget the décolleté, right?
Body,
like beacons for the sun, really, just like you're driving and you're...
I mean, you can kind of see it in the mirror when you're standing in front of the mirror. What areas get sun? All those areas that are darker than the other areas because they've been exposed to sun, they should get sunscreen.
Yep, that is true. That is true. And all of these products that we just chatted about are in the Restore AM set. So if you think that you can benefit from these are really just a beautiful regimen that work together. You can use this as part of your morning routine and really address not only visible signs of aging and support and restore the skin, but also improve visible discoloration at the same time. So I love that set.
Yeah, me too.
Great gift, and I think I'll just add a ton to cart and just have in my back stock because they're the best, truly. So second set we have today is our Restore PM set. So, speaking of in-office treatments and procedures and overnight care, are there specific products that you love to recommend that patients use in their nighttime routine to really help with healthy collagen production and help with plumping the skin? Anything in particular that you enjoy?
This one, of course.
Oh, let's pull it.
The HA intensifier. So
Yep.
This is my favorite, one of my favorites as well.
It's one of my favorites too, selfishly, I have to say. So this is a plumping and firming, hydrating, corrective serum. So I just want everybody to kind of look at that thickness, right? It's really beautiful. It has hyaluronic acid in it, of course, but it's so much more than a hydrating hyaluronic acid serum. It really is going to offer corrective benefits. It's going to plump, it's going to lift, really great for nasolabial folds here, really great for the marionette lines here, really great for crow's feet, so you can apply it around the eyes, really great for 11s. This helps to prevent the breakdown of hyaluronic acid, and that happens as we age.
Yes, absolutely.
Everything slows down as we age.
Yeah, it's unfortunate. It's true.
I really have an issue with that. So our hyaluronic acid keeps our skin nice and hydrated, and it looks healthy, and it feels plump. And so we definitely want to make sure we're maintaining that by applying topical products like HA Intensifier. You can also apply it directly onto the lips as well, which I love to get that extra plump there. And I know we even have, there are things that you can put into the lips to make them more plump and juicy looking, but this is a skincare product you can apply.
Yes, it's not the injectable version.
Yeah, not injectables, but you can apply it onto the lips to get that plump look as well. So HA Intensifier, beautiful for the full face, neck, and décolleté as well. Yep. Amazing. So let's dive into the rest of our Restore PM set. Retexturing activator here. Let's pull this one. Retexturing activator is a bifunctional exfoliating and hydrating serum. So I know, maybe in the evening you want to have a little bit of that increased skin cell turnover. So this really helps to offer that. I just want to show everybody this beautiful lightweight texture. I want you to feel this. So this is super light. It's going to move fast. It has kombucha in it, actually.
Yeah.
Helps to support the skin barrier. It has hyaluronic acid, of course, and then it has an aminosulfonic acid compound that really helps to gently break the bonds that bind the skin cells together. So it's gentle enough for even the most reactive or sensitive skin, which is great because a lot of patients can't tolerate harsher retinols sometimes, or glycolics or things like that. So this is a great option for you to use instead of, or even along with. So if you are using a retinol in the evening, you can alternate nights with retexturing activator. Maybe you use this in the morning and you use your retinol in the evening. Kind of a great combination there. So we love that.
Yeah. That's one of the beauties about SkinCeuticals as well, is the ability to sort of move through the retinols in dosing, right? Sometimes
exactly.
You can have a high dose or low dose depending on, and you can scale up, right? So that's one of the beauties of the line for sure.
Definitely. There are 3 different strengths, 0.3, 0.5, and 1.0 to slowly graduate your way. So you can definitely start low and slow and work your way up. And again, you can add additional products to your cart when you're checking out. You're also going to be receiving that complimentary shipping, that $100 gift card, and of course that site-wide gift with purchase, all with your purchase of either set tonight. And I know these are going to go fast because they feature bestsellers and some of our most awarded and most beloved products, leading us into the next formula, Triple Lipid Restore 242. I'm obsessed with this. I have oily skin, but I find that even though this is a thicker cream, my skin can tolerate it. And in fact, my skin loves it. And I think it's primarily due to the ingredients. It absorbs really quickly. It's super lightweight. You could see that fluffy texture. And this helps to restore essential lipids in the skin. So again, another thing that happens as we age, kind of like lipid depletion.
Yes.
Yeah. So we want to restore those essential lipids. You have fatty acids, you have natural cholesterol, you have ceramides in this formula, and you can use it both morning and evening as well. So we love Triple Lipid Restore 242 so much for both morning and evening application. So let's go ahead and I want to talk a little bit more about not only these products, but just in-office treatments and procedures. And I know you had another favorite product you wanted to chit-chat about when, after specific treatments, right?
Yeah, so sometimes we do some treatments that are a little spicy. Sometimes the Morpheus looked a little not so spicy because we did a good job with the...
You did a great job.
We did a good job with the numbing cream, and
Yeah.
then the Pronox helps quite a bit to get through the procedure, and the patient did really well. But, afterwards, sometimes this little guy right here, our phytocorrective gel,
Love it.
is fantastic. It's a cooling sensation that the patients love. It cools the skin by like 4 degrees. So people love the way that feels.
Yeah, let's go ahead and show everybody what it looks like. Even though it's green, it doesn't turn your skin green, which is the key here. I love the way it smells too. It's just kind of like fresh from the spa, almost. Has botanicals in it. Really helps to calm and soothe the skin. Helps to calm and soothe the complexion, cool it down, so post-procedure feels really nice.
They love it.
Yeah. Also has hyaluronic acid in it too, so gives you that plumping hydration. And you can add this to your cart when you're checking out. Although it's not a part of these sets, you can definitely add it in and continue that checkout process as well. So we love phytocorrective gel. Amazing. I do want to talk a little bit about how to layer everything together in a full routine. So layering is also key to
Absolutely.
The way that you're applying your products, when you're using your products. So let's go through each of these products and how we would apply them. Again, starting with CE Ferulic, this is going to be once daily in the morning after cleansing the skin, 3 to 5 drops, full face, neck, and chest. Then you would follow with Discoloration Defense all over the face, neck and décolleté as well. And then we would end with our Daily Brightening UV Defense SPF 30. And as Dr. Macias said, every day, rain or shine, no matter what. And then for the evening, we have our lineup here. You want to start with your Retexturing Activator, follow with HA Intensifier, and then you would end with your Triple Lipid Restore 242. Pretty easy, right?
Yeah.
Simple. We love it. So really helping to maintain and restore skin health overall altogether. Okay, so I have a question for you, another question, Dr. Macias. So what is your absolute favorite, top treatments to perform in office?
In office, it would have to be Morpheus.
Yeah.
Yeah, if it's for in-office procedures.
Okay.
If it's in the operating room, it'd be a facelift.
Yes. Okay, let's do that. Operating room. What is your most favorite procedure to perform in the operating room? I'm curious.
Facelift for sure. The deep plane facelift is a game changer. It's my absolute favorite procedure. We're finding that we're doing it in younger people than we were 10, 15 years ago, because we've noticed that if we treat early jowl formation and neck laxity with the deep plane facelift, that we get longer lasting results and it looks more natural. There's probably a lot of people that you see on camera that never really aged, and that's because they've been treated with this earlier instead of waiting till they looked like they really needed the facelift. They got it when they kind of needed it and have kept it up.
And that's the key.
And that's the key. The key's when you first start seeing, you don't wait till you look like your grandma in the mirror to go get your facelift. You start seeing your mom in the mirror and you're like, oh, okay, maybe it's time I go see someone.
Yeah.
And consider doing it a little earlier than we used to think we had to.
That's awesome. And you do everything here?
Well, we do the full body.
Okay.
We're board-certified plastic surgeons, so we've been trained in everything from head to toe. So we do mommy makeovers, breast lifts, tummy tucks, that kind of stuff. But I particularly specialize in the face, so I do facelifts and rhinoplasties are my 2 favorite procedures.
I love that. We were just talking about that earlier before we started the show. And truly, I think that plastic surgeons are artists in their own right?
Yes.
I think you're an artist. You're working with a canvas, right? Whatever that is, and transforming it. Truly. So as an artist and your patients being your canvas, do you have, again, things that when you're talking to them, that patient journey of what you want them to have in their routine no matter what, to really integrate that in-office surgical procedure with their at-home targeted skincare solutions?
Yeah, I mean, obviously,
We talked
about how we would have the patients come in and see our esthetician and make sure that they're on a good regimen for their skin that's comprehensive and is customized towards them. So that's very important. If I had to pick one product, it's the sunscreen. By far, the most important thing that anyone could use from childhood to the last day is that, like you said, rain or shine, cloudy or not, that's the one. I mean, just look at your skin. Like I said in the mirror, the skin that didn't see sun looks way better than the skin that has seen sun.
That's true. I think after we get off of the show, we're all going to be looking at our skin from head to toe and really examining that. I know I am. So that's awesome. I love that integrated approach to skincare and in-office treatments and surgical procedures to, again, get you to your skin goals faster, help to amplify and maintain those results, and really help you to achieve those longer lasting results too.
Absolutely.
Right? Love that. So I think we might have time for some questions from the audience. Are you ready?
Yeah, I'm ready.
I'm so curious. We have our producers live with us today. What is the chat looking like? What are people asking?
The chat is so active. Everyone is so excited. So many people asking how and when they can come visit you, Dr. Lee. So get ready. It's going to get even busier. But yeah, everyone.
I'm first.
We'll get a chance to sit in the
I'm
chair.
first. I'm first.
But yeah,
If you
everyone
get a mirror, you can let me know.
Wait,
what
I'm
I can do
first.
for you.
everyone's very
I'm going to get on the
excited
phone right now. I'm going to make my appointment at the front desk.
and loving.
Yes.
And they are loving all of the information. So it's a very active chat as always. One of the first questions that is popping up is what order in the evening would someone apply the HA intensifier and then an antioxidant serum if they were also using one in the evening? So is there a better order to do for that?
Yeah, definitely. So we talked about CE ferulic. This is your daytime vitamin C serum. In the evening, we have resveratrol BE. Resveratrol BE is your nighttime antioxidant serum, and you can definitely add that to your cart when you're checking out. That's going to go on first. So resveratrol BE in the evening, then follow with your HA intensifier. And resveratrol BE is very special. This is going to help to support and strengthen the skin's antioxidant defenses and your just overall firmness and radiance in the skin as well. So truly like a sleeping beauty serum. Feels so good on the skin, and you can really it assists your daytime antioxidant. So truly an essential if you're looking to have those visible signs of aging improved, like the fine lines, wrinkles, loss of elasticity, and just overall radiance to the skin, right? Yeah.
Amazing. Lots of chat today about sunscreen and protecting our skin. We have someone who's asking if they're not going to go outside and they're staying inside, or if there's a little bit of SPF in their makeup. What's your opinion, or what do you tell patients about sunscreen?
When you wake up, you should put on some sunscreen, because you still get some exposure, even though you think you're not getting exposure. And believe it or not, there's exposure inside rooms. So you should just wake up and put on your sunscreen.
Yeah.
Absolutely.
So what do you think about when do patients ever say, oh, I have sunscreen in my makeup? That's enough.
No, it's not. It's definitely not enough.
You heard that. It's not enough.
It's not enough.
Dr. Macias said makeup in your sunscreen is not enough. So
And those bathing suits that say they have SPF, not enough as well. So make sure you
still
put some underneath.
Still apply to the body. Yeah, head to toe, right?
Yep.
Head to toe. I mean, I feel like sunscreen daily is protecting your skin, but it's also protecting the investment that you're making in your skin every day with like time applying products, money that you're spending using products. And then if they're going to come see you for a facial treatment or procedure and they're not using their sunscreen, it's kind of like,
well, you're not protecting your investment.
Exactly. You're not protecting that investment. So if you take one thing away from today, you're going to hear Dr. Macias in your head when you wake up tomorrow morning. Apply your sunscreen.
Yes, absolutely. That's my one, desert island product for sure.
Yeah, non-negotiable.
Yep.
Sunscreen. Great.
Amazing. Also, I'd never have heard of bathing suits with SPF. What a concept. But yeah, definitely not skimping on sunscreen in any way.
Yeah.
We have a question about CE ferulic again, about using it twice a day. Is that a good idea? Should they be doubling up on it AM, PM, or is it only once a day?
Only once a day. Yeah, you only need to apply CE Ferulic once a day, and that's in the morning. Just make sure it's the first product that you're putting on after cleansing and toning if you tone. 3 to 5 drops into the skin, and then as Dr. Macias was explaining, also like the neck and the décolleté. You want a little bit for your hands. We were talking about the hands earlier.
Yeah.
And really protecting all of that skin and getting that antioxidant on. And then you can go ahead and follow with the rest of your routine. So you don't need to apply it in the evening, just once daily in the morning, every single day. And I get a lot of questions. I'm sure you get a lot of questions like this where patients ask, why is SkinCeuticals the antioxidant authority? Why are SkinCeuticals vitamin C serums superior? And I'm going to share just a little bit about why they're so iconic. They are backed by science, and that's why, you partner with us as a
Absolutely.
plastic surgeon, and why you trust us to provide pre and post-patient care, to provide those best results. But our vitamin C serums are backed by over 30 years actually, of academic science. They are backed by over 40 clinical studies, as well as hold more than 20 U.S. patents and patents pending, and more than 100 beauty awards and counting. And I say that because we're continually testing our products, just like you're continually learning about the latest and greatest.
Absolutely.
Right.
And that's why we became a flagship. No one better to sponsor with or to partner with than with SkinCeuticals, for sure.
Yeah, so if you're in the Marina Del Rey area, or just like Southern California in general, it's worth the drive. Marina Del Rey is just gorgeous. The office itself is gorgeous. You can see here we're in the treatment room. But yeah, definitely worth a visit. And if you're not local to the LA area or Southern California in general, you can locate a SkinCeuticals Skin Lab or flagship near you using our office locator. You can do that after the show because we don't want to lose you. Use our office locator, input your zip code, and then you'll see a list of flagships and skin labs pop up in your area. You can also use that $100 gift card that you're going to be receiving with your purchase tonight, and redeem on a qualifying in-office treatment at your nearest skin lab or flagship. No code needed. That'll come automatically included in your bundle. Amazing.
Yeah, so we have time for, I would say, 2 more questions. Question that's popping up is, what is the difference between triple lipid repair 242 and then AGE interrupter?
Triple lipid restore 242 and AGE interrupter advanced are both corrective creams. Do you have a preference of one or the other? Have you used them both?
I like the AGE, honestly.
Yeah. Yeah. And you can use them both. So Doctor likes the AGE Interrupter Advanced. I prefer the Triple Lipid Restore 242, but I'm going to tell you why. So Triple Lipid Restore 242 is really great to support and strengthen the skin barrier, nourishes the skin, and is really great for... we have a little... There we go. It's okay. My pants are going to have some Triple Lipid Restore 242. Restore that lipid depletion. So what you have here are essential fatty acids. You have ceramides. You also have natural cholesterol. So all of these really help to make up the skin barrier and support it. As we age, unfortunately, and just with the environment and various things, that can kind of break down. So this is really good for anybody concerned with facial smoothness, improving overall radiance, texture, fullness, and minimizing the appearance of pores. So think more like surface of the skin. While AG Interrupter Advanced is great for collagen decline. So more...
That's why I like it.
No, your skin looks great.
Well, I mean, I'm getting older.
It's because you're using AGE Interrupter Advanced.
Might be.
And your sunscreen.
And a little bit of the neuromodulator.
A little bit of, you know what? We don't lie here. A little bit of the neuromodulators. Love it.
Perfect.
I swear I'm going to pop into that chair after.
So we have time for one more question, and it's questions for you, Dr. Lee. So someone's asking if they have just had a treatment similar to the one that you performed here yesterday. Mm-hmm. How soon after should they start using actives or retinol or something like that on their skin?
That's a fantastic question. We get that question quite often. Some people say a week. That's what most people say, a week to 2 even. I've heard some people say. Obviously, I put one on right after. and the treatment. So it depends on who you have it done with. So I would talk to them, defer to them, ask them what their protocol is. If you come to us, we might use it right then and there, but others would probably most of the time tell you active's about a week out.
Perfect. Thank you. So yeah, I mean it. You'll see the chat after. So many people here asking to come in and for both of you to do this show more often. So the chat is still very active, and I think people are so excited to hear about the bundles one more time. So yeah, thank you so much to both of you.
Amazing.
You're very welcome.
I mean, I might not leave. I might just live here. That's the perfect chair for me to sleep on. Amazing. Okay.
You might fall asleep when we do the treatment.
I might, actually. That looked amazing. The treatment yesterday, she was in and out. She was the happiest patient I've ever seen, and that truly is probably your touch.
She was really happy, honestly. Honestly, some people say it smarts, and she was. It wasn't spicy at all for her. She was smiling the whole treatment. So
that's great.
A little bit of camera magic, I guess. I don't know, but
it was all you.
No, it was definitely the treatment. It was. She was a perfect candidate. So
that's awesome. And you did apply CE Ferulic immediately after,
yes,
so I loved seeing that too. Yeah. Great. So let's move through both of these bundles and give you a quick overview of each one. Let's start with the Restore AM set. We're going to pull that up on the screen for you to really get an idea. All full-size products. CE Ferulic, your daytime vitamin C antioxidant serum. Discoloration defense to help even the skin tone and really target that stubborn discoloration that Dr. Macias sees patients with coming in after long summer. And then daily brightening UV defense SPF 30. You heard it here. Dr. Macias, non-negotiable. Rain or shine.
the more you use that, the less you'll probably need that.
Love it. There you go. We want to really protect the skin, right? Okay, so Restore PM set. You have your retexturing activator for exfoliation and hydration at the same time. That's gentle enough for even the most reactive skin. We have HA intensifier for plumping and firming corrective hydration. And then we have triple lipid Restore 242 to really help nourish the skin and replenish essential lipids to help improve skin fullness, smooth texture, and improve overall radiance. Amazing. So in addition to all of these amazing sets, again, you're going to be receiving the complimentary shipping as well as that $100 in-office gift card that you can use. And you can find SkinCeuticals flagship or Skin Lab locations near you by using our office locator. After the show, you can go ahead and locate one via your zip code on our website. Amazing. Well, this was so much fun, Dr. Macias.
Thank you so much.
Thank you. I had a pleasure. I love that it was your Pro Live debut and that we really got to see you in action yesterday. Perform treatments. You do so much here. Again, beautiful office. Let's remind everybody how to connect with you before we log off.
So at Dr. Luis Macias or Dr. Luis Macias on Instagram or at Aesthetic MDR.
Amazing. And our moderators are going to be around just for a little bit longer to answer any and all of your questions. They're also going to put information on how to get in touch with the office here, as well as those handles that Doctor was sharing just a second ago. But it's been so much fun. I hope you learned so much about how to integrate in-office treatments and procedures with advanced skincare backed by science. Thank you for your partnership, and we'll see everybody next time.